Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Does the low-oxalate diet help prevent kidney stones? A low-oxalate diet may be recommended for various medical conditions, including kidney stones. It involves cutting out foods high in oxalates and eating calcium-rich foods. A food list can make the diet easier to follow. /r/n/r/n West End 61, Getty Imagesrnrn Oxalate, also known as oxalic acid, is a natural substance found in many plants, such as fruits, vegetables, grains, nuts, seeds, and cocoa. The body can also produce it. /r/n/r/n Once eaten, oxalate can bind to minerals such as calcium and iron. This usually happens in the digestive tract but can also occur in the kidneys and parts of the urinary tract. It is most often excreted in stool or urine. /r/n/r/n Most people can tolerate oxalate well. However, high-oxalate diets can cause health problems, such as kidney stones, in some individuals. /r/n/r/n Following a low-oxalate diet involves eating fewer foods that contain oxalates, especially those high in oxalates. It doesn't mean you need to eliminate all sources of oxalate in your diet. /r/n/r/n Foods high in oxalates include certain plant-based foods such as some vegetables, fruits, nuts, seeds, grains, and legumes. The oxalate limit to stay under per day will vary from person to person depending on the condition you have, lab results, and other personal health factors. /r/n/r/n Soaking, boiling, and cooking some vegetables and legumes can help decrease the amount of oxalate in those foods. /r/n/r/n One of the most important things you can do on a low-oxalate diet, besides limiting high-oxalate foods, is to drink plenty of water. This can help flush out excess calcium or uric acid in your body. Stay hydrated by drinking 8 to 12 cups of liquid per day. Talk with a healthcare provider about the amount of water right for you. /r/n/r/n Other dietary modifications include eating more calcium-rich foods, avoiding excess protein, avoiding vitamin C supplements, and decreasing the amount of sodium in your diet. /r/n/r/n Low-oxalate foods that are recommended include /r/n/r/n Low-oxalate beverages include /r/n/r/n High-oxalate foods recommended to avoid or limit include /r/n/r/n High-oxalate beverages to avoid or limit include /r/n/r/n Following a low-oxalate diet each day may help decrease the risk of forming new kidney stones. /r/n/r/n A 2024 study comparing a conventional diet to a low-oxalate diet in 112 people suffering from kidney stone disease found that a low-oxalate diet helped prevent kidney stones. The researchers noted that a low-oxalate diet is associated with a lower risk of hyperoxaluria, too much oxalate in the urine, without altering the metabolism. /r/n/r/n A 2021 review examining the appropriateness of a low-oxalate diet for people with kidney stone disease determined that current available evidence indicates that dietary intake of oxalate has strong associations with urinary oxalate and the risk of kidney stones. /r/n/r/n Aside from following a low-oxalate diet to reduce the risk of kidney stones, some people follow it for other health-related reasons. /r/n/r/n Individuals with cystic fibrosis, CF, tend to have more kidney stones than those without the condition. To help decrease the risk of kidney stone formation, people with CF are often required to follow a low-oxalate diet. /r/n/r/n Low-oxalate diets have been considered in treating vulvodynia, a chronic condition characterized by pain or discomfort in the vulva. Some case studies have shown that following a low-oxalate diet has positive effects on individuals with vulvodynia. /r/n/r/n. However, few studies are available on this topic, and overall conclusions do not support following a low-oxalate diet to help treat vulvodynia. More research is needed to determine if vulvodynia can be treated by modifying dietary intake of oxalates. /r/n/r/n. The association between diet and autism spectrum disorder has arisen in recent years, causing controversy. Although there may sometimes be an overlap of gastrointestinal disorders and autism, there is no available research suggesting that dietary oxalates cause autism, nor is there any evidence that a low-oxalate diet is beneficial for treating autism. /r/n/r/n. A low-oxalate diet can be difficult to follow long-term. Careful attention is needed to ensure oxalate intake isn't too high each day. Eating out or attending social events where food is involved may pose a particular challenge to finding low-oxalate food options. /r/n/r/n. A low-oxalate diet restricts several nutritious foods, including many vegetables, fruits, nuts, seeds, legumes, and starches. In restricting these foods, the intake of beneficial nutrients such as dietary fiber, vitamins, and minerals is also prevented. /r/n/r/n. For example, spinach is high in fiber, calcium, magnesium, and vitamin A. Beets are a good source of potassium, folate, and manganese. Finding alternative foods that provide these nutrients is crucial to ensuring a nutritionally adequate diet. /r/n/r/n. People who follow a special diet or have specific dietary restrictions may find it difficult to follow a low-oxalate diet in addition to their other dietary restrictions. /r/n/r/n. Vegetarians and vegans may have a hard time getting enough protein, as many plant-based protein sources such as beans, legumes, nuts, and tofu tend to be high in oxalates. Meal planning is especially important for this demographic to ensure adequate protein intake. /r/n/r/n. Oxalate dumping is an alleged condition some think occurs when dietary intake of oxalate is suddenly decreased or eliminated. Those who believe this exists say a decrease in dietary oxalates causes the body to rapidly eliminate oxalate stores, which might lead to several adverse side effects. /r/n/r/n. No studies have been published on this perceived phenomenon, so evidence-based information surrounding this condition is lacking. /r/n/r/n. If a healthcare provider has recommended a low-oxalate diet, discuss whether you should gradually reduce high-oxalate foods. Also, report any symptoms you develop after starting the diet, as they might point to other conditions that can be addressed. /r/n/r/n. Eating foods high in calcium. When eating foods containing oxalate in the same meal or snack can help decrease calcium oxalate stone formation. This is because the calcium is more likely to bind with oxalate in the stomach and intestines before it gets to the kidneys, helping to prevent kidney stones. /r/n/r/n. Because of this, some experts suggest that a balanced calcium intake of 1000 to 1200 mg/mg per day may be an alternative to a low-oxalate diet in kidney stone prevention. /r/n/r/n. A prospective cohort study involving 24,620 participants aged 20 and older between 2007 and 2018 examined the association between milk consumption and the risk of kidney stones. The researchers concluded that higher and more frequent milk consumption in women is associated with a reduced risk of kidney stones. /r/n/r/n. 3 servings of dairy per day can help you to get the recommended 1000 to 1200 mg of calcium per day to help lower the risk of calcium oxalate kidney stones. /r/n/r/n. Following a low-oxalate diet is one strategy to prevent kidney stones. However, it is not the only thing you can do to help decrease your risk of developing kidney stones. /r/n/r/n. A low-oxalate diet combined with drinking more water can be especially helpful in preventing kidney stones. Water can help flush or detox the body of other substances that are often involved in kidney stone formation, such as calcium and uric acid. /r/n/r/n Additional strategies to help decrease the risk of developing calcium oxalate stones include /r/n/r/n Before making any dietary changes, it's recommended that you consult a healthcare professional. They can help you determine whether a low-oxalate diet is right for you. /r/n/r/n If you are already following a low-oxalate diet, contact a healthcare provider if you experience any new or concerning symptoms such as /r/n/r/n Meeting with a registered dietitian, RD, or registered dietitian nutritionist, RDN, can help provide you with tailored dietary recommendations and meal planning suggestions for following a low-oxalate diet. Having this support can help you stick to the diet while meeting your overall nutritional needs. /r/n/r/n The National Kidney Foundation website has free information regarding calcium oxalate stones and following a low-oxalate diet. /r/n/r/n A low-oxalate diet involves reducing the amount of oxalate-containing foods. Foods high in oxalates include certain plant-based foods, such as some fruits, vegetables, nuts, seeds, grains, and cocoa. Notable high-oxalate foods include spinach, beets, chocolate, rhubarb, almonds, and navy beans. /r/n/r/n A low-oxalate diet is often recommended for people prone to developing calcium oxalate kidney stones. Drinking plenty of water can help flush the body of substances that aid in kidney stone formation. /r/n/r/n Eating the recommended amount of calcium each day can also help prevent kidney stones from forming. Additional dietary strategies in preventing kidney stones include limiting sodium intake, eating moderate amounts of protein, and avoiding vitamin C supplements. /r/n/r/n Low-oxalate diets have also been recommended for people with cystic fibrosis, as they tend to have a higher risk of kidney stones. Low-oxalate diets have also been explored inconclusively with conditions such as vulvodynia and autism. /r/n/r/n The downsides to a low-oxalate diet include long-term adherence, food restrictions that reduce nutrients, and its challenge to meet nutritional needs in people following other specialized diets. /r/n/r/n Meeting with a registered dietitian nutritionist can provide guidance and ideas for increasing diet adherence while meeting nutritional requirements. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.